Let us to start the gynecologic jars. Starting by some congenital anomaly like this case. This case did abdominal hysterectomy after accumulation of blood inside the uterus, hematometer, and hematocervix. A common cause of this is imperforate hymen. Yes, actually this case was an imperforate hymen presenting by amenorrhea and urine retention. The common presentation of this case. And this case should be investigated by ultrasound and mostly should do in IVP to avoid or to detect anomaly of the urinary tract. About 40% of cases will have. This case treated again by panhysterectomy. And if you are deciding to do imperforate hymen surgical incision without hysterectomy, it should be treated in a governmental hospital for the patient to be given a certificate. Another types of jar in gynecology are those of chronic cervicitis. This is a type of chronic hypertrophic cervicitis. Again, this is a type of chronic hypertrophic cervicitis with closed small area named the Nepocian follicle. Two types of cervicitis present here. The operation done here is the removal of the cervix by amputation. These jars are pathological states of abnormal uterine bleeding. Here there is a second wall of the uterus, second endometrium, thickened wall of the uterus and the endometrium, and here you can see small endometrial polyp. Here again, second wall of the uterus and the endometrium and a small endometrial polyp, and here proliferative endometrium and second wall. All of these cases are hyperestrogenic states occurring in the middle age group and present clinically by a short period of amenorrhea followed by bleeding. It is named metropathia hemorrhagica. The operation done here in all of these cases is total abdominal hysterectomy and bilateral salpingo-oophorectomy. All of these cases, if not treated well, could be complicated later by endometrial hyperplasia and endometrial carcinoma. This group of jars are belonging to fibroid. A fibroid is a benign ovarian tumor arising from the uterine muscle and surrounding fibrous tissue. Look to this jar. Here we remove the uterus, the tubes and the ovary, but the uterus is cut in the coronal section to show a large submucous fibroid burrowing itself to obliterate the uterine cavity. Here, this is the uterus. This is the cervix. This is the uterus. This is a large subserous fibroid arising from the posterior wall. The operation done again is total abdominal hysterectomy and bilateral salpingo-oophorectomy. This jar shows a large submucous fibroid. This is the wall. This is the wall of the uterus again. And the wall is open to show a large submucous fibroid bulging to fill the uterine cavity. The operation done again is total abdominal hysterectomy and bilateral salpingo-oophorectomy. Okay, looking to this uterus cut longitudinally, it shows multiple fibroids, but these multiple fibroids, okay, it shows necrotic changes in some areas here and there, here and there. So this Horley appearance present, the Horley appearance present here is not there. The Horley appearance demarcating the wall of the fibroid and its content is not present here. This type of degeneration may be hyaline degeneration and is a common complication occurring in the fibroid. Look to this jar. It is removal of the uterus again without the cervix. So it is named subtotal hysterectomy. Here is the wall of the fibroid will circumscribe the area, another fibroid, another fibroid, another fibroid, another fibroid. Here fibroids are well demarcated, not like this. Okay? The operation done again is subtotal hysterectomy with unilateral salpingo-oophorectomy. Here, this is cervix, this is the body of the uterus, this is the cornea of the uterus. The cornea of the uterus towards the tube is open to show a large fibroid inside. Okay? The operation done again, total abdominal hysterectomy with unilateral salpingo-oophorectomy. We can see unilateral from here. This is one side, the other side is not present. Looking to this jar is opened longitudinal again to show the cervix. Cervix is totally free, but a large submucous fibroid filling the uterine cavity. Again, this is submucous fibroid. The operation done is total abdominal hysterectomy with bilateral salpingo-oophorectomy. Here, this jar, it shows multiple fibroids arising from all sides of the uterus. Here is subserous 1, again subserous 1, subserous 1. This is submucous 1, submucous 1, submucous 1. Looking to the wall, this is interstitial 1. So all types of fibroid present in this jar. The cervix again is free. The operation done is total abdominal hysterectomy with bilateral salpingo-oophorectomy. This jar appears similar to the previous one. Multiple uterine fibroid, number 1, 2, 3, and so. All of these are fibroids, so all types of fibroid present, subserous, submucous, and interstitial 1. The cervix again is totally free. The operation done is total abdominal hysterectomy with bilateral salpingo-oophorectomy. This jar is well demarcated, showing a normal or slightly dilated cervix, and a second wall, and a large fundal myoma. And this tumor filling the upper part of the uterine cavity, and 2 fallopian tubes and ovaries are present. So the operation done is pan hysterectomy or total abdominal hysterectomy with bilateral salpingo-oophorectomy. Looking to this jar is contain a uterus open longitudinally. The cervix is enlarged but containing no mass. Here is a mass, large mass arising from the posterior of the uterus and burrowing itself inside the cavity. So it is a submucous fibroid associated with symmetrical enlargement of the uterus or myometrial hyperplasia. This is the cervix again. The uterus is opened from the anterior wall to show a large mass filling the uterine cavity. This mass starting interstitial and burrowing itself to be submucous and filling the uterine cavity. This mass is showing a type of degeneration because it loses the whole appearance of the uterine muscle. This type of degeneration of white color, it is mostly hyaline degeneration. Here is a polyp coming down from the upper part of the uterus, projecting itself from the cervix out. This is the origin of the tumor, and this is the pedicle of the tumor, and this is the rest of the tumor. So it is submucous corporeal fibroid polyp. Note the associated myometrial hyperplasia. The operation done here is total abdominal hysterectomy and bilateral salpingo-oophorectomy. Looking into this jar, the cervix is dilated and containing a mass protruding from it. The uterus more or less normal size with 2 ovaries and the tubes are present. This cervical fibroid is usually polypoidal as it comes out. So it is a cervical fibroid polyp, and an operation done is total abdominal hysterectomy and bilateral salpingo-oophorectomy. Again, this is cervical fibroid polyp. The uterus appears more or less normal with 2 tubes ovaries and the cervical polyp coming out. It is a cervical fibroid polyp, and the operation done is total abdominal hysterectomy and bilateral salpingo-oophorectomy. This jar again the same, but the uterus appears more enlarged than before. So this uterus may contain inside an interstitial or submucous myoma, but this is a large one of cervical fibroid polyp. A large cervical fibroid polyp protruding from the cervix associated with an enlarged uterus. All of these, the operation done is total abdominal hysterectomy and bilateral salpingo-oophorectomy. Look to this jar, but from the cut end. Here, the cervical fibroid polyp protruding from the cervix and the normal or less normal sized uterus. Tubes, ovaries, okay? The operation done is total abdominal hysterectomy and bilateral salpingo-oophorectomy.